Hello, this is my second chemo update. I have kept a journal since the first time. Each day I've wrote down how I felt and side effects, symptoms, stuff like that. It's been really helpful for me the second time around to look back and kind of see what to expect. Um, anyway, I've noticed that I felt fine until day three. Day three has been the hardest both times around, and it's mainly from the steroids that you're coming off of from the, they give you the steroids during the chemo. Just kind of makes your body work a little harder. The steroids were no fun to come off of. You feel real agitated, nervous. It just sucks. So I noticed I felt kind of flu-like symptoms for the first, let's see, from day 3, 4, 5, and 6. Day 7 I felt fine, and all the way up until day 11 I ended up catching a cold. So unfortunately, well, I have a 5-year-old, so um, who knows what kind of stuff I can pick up very easily from going to her school, being around all the other kids. Anyway, so I did catch a cold, and I ended up with a fever of 100.4. 100.5, they say go to the ER. So I went to the ER with 100.4. My white blood cell count was extremely low, so they decided to keep me there. And they were going to keep me there longer, but they started me on these Neupogen shots, which, and I think I got that right. I think it's Neupogen. And it was daily. So for 2 days, I had the shot in the tummy. It didn't hurt. They said to maybe expect bone pain. Didn't have any side effects from that, but it brought my white blood cell count straight up. So I was able to go home on day 3. From that then on, I felt fine. Day 14, I started losing a little bit of hair. Day 15, it came out in chunks, so I had my cousin come over, and she had her shave it off for me, and it felt a lot better. It's still hard to get used to. It's hard to look at yourself in the mirror. I try not to. I pretty much wear my wig all the time. I sleep with either a beanie or a scarf. But other than that, I mean, the wig's fine. It's a little itchy. It does itch a little bit. So it helps if you maybe wear one of those little stocking things that they give you to put on your head underneath. So anyway, after all that, I mean, I felt fine. So, but then for the second chemo, they split it up between, one was on a Friday, 2 medications. One was on a Friday, and then the Taxotere I had on a Monday. And they did that only because they wanted the Taxotere drip to run a little longer. They didn't want to do it too fast since I had that reaction. But didn't have allergic reaction to that. Felt fine. Day after, I ended up going in for a Neulesta injection, which my doctor decided I needed since I had such a low white blood cell count the first time around, which is the same as the stuff they give you in the hospital, or it's similar. It's just a lot stronger. So you don't do it daily. It's just day after chemo, you get the Neulesta, and they did say some bone pain, which I don't know. The bone pain I definitely felt, but not right away. Day 3 again was hard from the steroids. Felt real nervous, emotional, felt real irritable. So yeah, day 3 again was not fun. Day 4. See, and this is hard because they did they did the chemo 2 separate days, so I've got day 4, day 1 of Taxotere and stuff like that. So what I think was hard the second time around is that I had both the medications separate like that, and a few, 3 days apart, and so it feels like my side effects were just stretched a little longer. The first time around, I only had the side effects for like 3 or 4 days from the chemo. Then you feel the flu-like symptoms. But this time around was just a little different because we did it differently. By So I pretty much felt kind of, tired, this and that. There's a couple days in there I felt fine, but day 9 of the Cytoxin, which would be day 6 of the Taxotere, is when I felt the bone pain from the Neulesta injection. And it was it's a scary feeling because it's in your spine. Um, it's just this achy, like throbbing. You could feel it throbbing. And which is the medications encouraging your bone marrow to produce the white blood cells rapidly. And that's where the bone pain comes from. Didn't keep me home. I took one of my Vicodin that I kept. Luckily, I kept my pain medication from my surgeries, not thinking I would need them, but just in case. And definitely, the Vicodin helped. Tylenol, but I took some Tylenol, but it was definitely the Vicodin that helped. Took Xanax at night to help me sleep because a lot of the nights were I just couldn't sleep. But hopefully, I can get off of sleep medication when all this is through, because I've kind of been depending on stuff to sleep because obviously I've been real nervous and scared and sick, and and it's hard to sleep with the surgery, the mastectomy, the tissue expanders, which I did have expanded again. So I I think the last time they put 120 cc's, which was really pushing it, and I had pain from it. So this time we went with just 90 cc's, and I had no discomfort at all, and I felt fine. So total, I have 310 on each side, and guess we're kind of halfway through that part, but that's the easy part. It definitely, the chemo has been the hardest. It's doable. It's definitely not, it's just the flu stuff, just sleeping it off. But so after the bone pain, day 10 of the Cytoxin, day 7 of the Taxotere, which was yesterday, felt fine. So the Neulesta injection, the bone pain was just the one day that I felt that, and I feel great now. Other than that, I've had no problems. So it's just been just kind of discovering what to expect. What your body, what it's like. I said, the journal's been helpful, so I kind of can see in advance, like, okay, tomorrow I might feel kind of crappy, or it's just, I don't know. It's definitely different. I'm halfway through. I've got 2 more chemo sessions left, which I should be very thankful for, because I did run into someone there who had a pretty advanced stages of colon cancer, and he said he had to have chemo every 3 weeks for the rest of his life. So pretty fortunate that I only have the 4, which is it's hard. I think the Taxotere is definitely a strong medication. So hopefully it will get easier, because being in the hospital and then having this second time, I mean, it's just been really rough, and then when I'm done, I don't know if I have to have radiation. Most likely I won't, because there's really nothing to radiate. There was no, they took all tissue, so hopefully I won't have to have radiation. My surgeon said most likely I won't, and but we'll see. I'll see. We'll see if I have to. But then after that, I will have my tissue expanders switched for whatever implant we decide. But I'm still using the port for the chemo, which has been. I was against it in the beginning. I didn't want the port. I'm grateful I have it now. I'm not looking forward to the removal of the port, but I guess we'll cross that bridge when we get there. So anyway, I'll keep you guys updated on the on chemo number 3, and let you all know how I'm doing, and talk to you then. Thanks for watching.